Everyone to the Arthritis New Zealand Foot Pain webinar. This webinar is kindly sponsored by Pfizer, and I'm Robyn Tuohy, an Arthritis Educator with Arthritis New Zealand. During this webinar, there will also be 4 pop-ups questions for you to answer, so look out for them. We'll also have time at the end of the presentation for questions that you're welcome to send in. The Q&A box, use the chat function. I'd like now to introduce Dr. Keith Robyn. He's Professor of Podiatry at the Auckland University of Technology, who is Head of Research there, and he's spent over 25 years researching long-term foot conditions and has published over 130 articles. He's been awarded a fellowship from the Society of Podiatrists for his contribution to research and has an international profile with clinicians and rheumatologists. In this presentation, Keith will discuss the role of the podiatrist, foot problems and the benefits of footwear and exercises for foot pain. So let's get started with the webinar. Thanks, Keith.
Thank you. Thank you. Thank you for those introductions and welcome everyone. And thank you for listening to hopefully a useful presentation about foot pain with people with arthritis. I am going to talk about rheumatoid arthritis, and I'm going to talk about gout, but also I'm going to allude to people with osteoarthritis as well. So the first thing I'm going to talk a little bit about is the role of the podiatrist. Now, some of you may have been to a podiatrist before, and some people actually haven't been to a podiatrist. Our role is really to look after people's feet, and you can see here by these illustrations that we deal with a range of foot problems ranging from skin that has cracked, or that there's needing to callus or hard skin to be removed, and corns. We also deal with abnormal toenails. Sometimes they're thickened, or sometimes we've had people with ingrown toenails. But also we deal with mechanical problems which are associated with the foot. So some people may suffer from heel pain, or bunions, or arch pain, or ankle pain, or a combination of all those particular conditions. So you can see we deal with a whole range of particular conditions. Now, when you do see a podiatrist, and when you see someone who looks at feet in a particular way, is that we watch how you walk. And the reason behind that is that we want to see if you walk very, very slowly, very meticulously because of foot pain, or it could be simply that you walk because of other problems not only associated with your foot, but with your knee, for example, or your hip, or your lower back, because they're all interconnected. So that's why we see how you actually walk, or we may get you to stand up and we observe certain components of your foot and the rest of your body. But also we will start to look at certain movements within your foot as well. And what we're looking for is that the range of movements of the foot. We'll also look at your pulses. You've got a couple of pulses in the foot which we look at, but also the temperature. Is it very, very cold compared to the outside environment? Also the condition of your skin, i.e. is it supple or is it a dryness associated with your particular condition, and looking and observing any joint deformities. So other skills we have as podiatrists is that we use a whole range of manual skills, for example, scalpel work, or we can use some chemicals which to reduce some of the calluses, and we would also give you advice on footwear, and I'm going to talk a little bit more about advice on footwear later on in the presentation. And that advice is related to education and self-management of foot problems. But sometimes we talk to our patients about foot orthosis or shoe inserts, and we'll talk about different parts of the shoe and also the shoe inserts in more detail. But really we can talk about the manufacture of them and also enhance how you actually walk with your particular foot problem. So what I'm going to do is I'm going to illustrate some of the uses that the podiatrists have in treated particular people, and I'm going to use the first case study on someone with rheumatoid arthritis. So this was a typical case that we actually see in our clinic. So here you have Kim, who's been diagnosed with rheumatoid arthritis for over 20 years and is being prescribed methotrexate by their rheumatologist. The rheumatologist referred Kim to our podiatric clinic due to pain on the sole of the foot, particularly when walking, and that is a very, very common observation we see. When we assessed the foot, we found limited range of movement and some hard skin over the balls of her feet as well. When Kim was walking, we saw that she walked very, very slowly and very, very meticulously. But the biggest problem Kim has is finding adequate footwear and preferring to wear open-toe sandals throughout the year, regardless of the weather. So, the first of the 4 poll questions: what do you think is the most common site of foot pain in people with rheumatoid arthritis? So we've got 4 options here. It's either the toes, the sole of the foot, what we sometimes describe as the forefoot, the heel, or the top of the foot. I'll just give you a couple of seconds to think about that. So if we carry on, we can see that in this particular illustration that we have lots of people who support the idea that there's lots of problems in the foot, related to the foot first of all, and you can see the illustrations here underneath the sole of the foot, and here is a nice diagram illustrating the high peaks. This is pressure under the sole of the foot. So this is the heel area, and here are the peaks. But what we have found that most people with rheumatoid arthritis, with established rheumatoid arthritis, suffer with the forefoot problems underneath here. They talk about walking on pebbles as they walk. So you can see the particular issues illustrated in these 2 pictures here. So really it's the sole of the foot which suffers the most. So why does a person with a lot of problems in the sole of the foot affect walking? We have found that as the disease progresses, the foot becomes more rigid, and that rigidity is a result of high forefoot pain, or due to mechanical causes, but also due to inflammation as well over a number of years. So you've got a combination of these 2 factors coming into play. So what we see is that the person with established rheumatoid arthritis walks slowly and spends more time with foot in contact with the ground, which likely is to cause more pain. And as the foot deformity increases, patients find it difficult to find footwear because of the width. As you can see here, the deformities in this particular instance here of someone with a bunion and lots of hard skin over there, over what we describe as metatarsal heads, or over the bony prominence, which in this instance is quite painful for the patient. But sometimes we don't see these calluses, but we do see lots of inflammation around these particular joints. So what about from a patient's perspective? And this is a really nice study about the kind of problems people experience in trying to purchase retail footwear in people with rheumatoid arthritis. Although this is a study from the United Kingdom, we have also done work here in New Zealand. And this is a really nice statement. One of the statements a patient actually explained is that, although only being 36 years old, is that sometimes I don't want to wear shoes that are looking like a 70-year-old. and I want to wear something which relates to me as a woman. And that is a very typical comment made by someone with rheumatoid arthritis and some of the problems that is encountered with this particular condition. So the second question is, what is the most important feature of footwear do you think people look for in terms of footwear with people with rheumatoid arthritis? And here we've got 4 questions or comments that you can report. Is it related to comfort? Is it related to style? Is it related to heel height? Or is it related to colour? So I'll give a couple of minutes for people just to think about that, and then we can carry on to the next slide. Okay, just looking at the poll, most people 100% agreed in its comfort, which is, yes, the most obvious problem. And this is a particular study we undertook a few years ago, choosing shoes, challenges to clinicians as well as to patients. And what we found in this large study is that comfort was the biggest factor, followed by fit. So, as we say, comfort is the key issue. And what we also found is that in this particular study that over 80% of people with established rheumatoid arthritis were found to have foot pain, disability and impairment. And the key issue which came out from this study and other studies we've undertaken is finding adequate footwear. We undertook a study just to continue on the theme of footwear and some of the problems, is that through Arthritis New Zealand, we took a survey looking at seasonal variations. Do people wear the same footwear regardless if it's wet, cold, hot, or it's humid outside? And what we found was that people tend to wear the same type of shoes throughout the year, and including sandals and mules as well during the summer periods, which is not surprising at all. But what we are finding is the trend here is that people do tend to wear one pair of shoes which they feel very comfortable with and tend to wear it throughout the year. So a big question which people do ask me, what should you look at in terms of sandals? What are particular characteristics that you should be looking at? And this would be a typical sandal that we would probably recommend. As you can see here, it's got supporting straps so it can hold the foot in place. It's got sufficient width and adequate toe room, so therefore if you have got a bunion, for example, and you've got a very wide forefoot, it can actually accommodate those particular problems. It's got a little bit of a heel. I think it's important we do recommend to have some heel in terms of a shoe. And it has to have a stabilizing heel cup, i.e. the back of the shoe should be quite stable to hold the back of the foot in place. And it should be lightweight. I think that's a very, very important characteristic. Those people with either osteoarthritis or rheumatoid arthritis say they always like to wear a shoe which is quite light. And also, you've got a cushioned insert, which is always helpful, and whether we can add something to that, it's quite important to take that into account. So those are some of the characteristics that we would recommend people to look at in terms of purchasing a new sandal. But also what we can do to enhance the shoes that you're actually going to wear is that we can add something to it. And we use the word foot orthosis or shoe inserts, whichever the word you're familiar with, and that correct or accommodate the deformity. It can also protect against further deformity. A very, very important aspect is pain relief, and that may well be due to the limited movement, particularly when walking or weight bearing. And one other aspect we look at is improving function, and sometimes we can do that, particularly when we have newly diagnosed people with either rheumatoid arthritis or osteoarthritis as well. So here is a typical way that we produce an insert, is that we take an impression of the foot. This is a foam box. As you can see here, we place the foot into a foam box, and then we can do a number of different tasks with that foam box. We can add plaster of Paris. We then send it off to a manufacturer, who then comes back with this kind of device. Now, it does need modification. Sometimes it's very much a trial and error, that when we fit it, we may have to change certain aspects of the foot orthosis. But that just gives you an illustration of the type of foot orthosis we actually use. So going back to Kim, the case study, what we did is that we talked to Kim about wearing suitable footwear for everyday use, and that by going through that particular process, we found that foot pain actually was reduced, but we're still monitoring, and that we certainly do take a multidisciplinary team approach to people with arthritis, because it's not only ourselves as podiatrists, but the rheumatologist, the rheumatology nurse, if the case we're dealing with some quite nasty foot lesions. It could be also dealing with people from physiotherapy or occupational therapy. It's very much a team approach. So the second condition I like to talk about is gout. Now, here's a really nice picture at the evening down in Auckland on the viaduct, and you're probably wondering why I put this picture up. I think something which is always highlighted when I do presentations is I do use this photo just to highlight that Auckland is the gout capital of the world, which is quite surprising. We do have a very high prevalence of gout, particularly in New Zealand, and South Auckland in particular has got a very, very high rate of gout. So we do see lots of people with gout. Now, I know a lot of people may not have gout who are listening, but what do you think is the most common site for foot pain for people with gout? And here we've got 4 options. It's either the arch of the foot, the sole of the foot, the heel, or the big toe. So think for a couple of minutes on which is the area where you think gout affects the biggest part of the foot. Okay. So if we carry on, and 100% great, excellent. Yes, the big toe is the most common part of the foot which gout affects. In fact, it's the biggest part in the whole body. It actually affects around the big toe itself. And here is a study which was undertaken in the UK, which illustrates this, but we've shown this in New Zealand as well. But also people suffer with gout around the ankle, around the heel, and over the toes as well, but mostly around the big toe. And without getting too technical, what it is gout is urate crystals which form in joints. And what we have found through our studies is that most people who do suffer with gout, about 73% of people with gout, have problems at the big toe. But it does affect other joints, and what we've seen with some of our studies, it affects the Achilles tendon and the back of the heel there. So again, it goes back to illustrate that the role of the podiatrist here, that we do see quite a few cases with people with gout on the big toe. As an example of someone we've seen at our clinic, and this is the kind of shoes or footwear they actually wear for the gout, because it was the most comfortable shoes for them. So this is a typical case that we see someone with gout. So the last of the poll questions is, again, what do you think is the most important feature of the shoe reported by people with gout? Is it related to comfort, style, cost, or colour? So again, I give a couple of minutes for people just to think about which is the most important feature. Okay, And again, a majority of people will say comfort, which is correct. And you can see here by this slide that when we undertook a number of studies related to footwear with people with gout in New Zealand, and comfort came out top. Again, you can see 98% of the study we undertook with about 100 people with gout said comfort was the key component. Then fit came into play. And we've done a similar study in America, and we have found very, very similar findings that comfort is a big issue with people with gout. So one of the studies we've undertaken, and we're still looking at our results, is that we looked at commercially available footwear on people with foot pain and disability. And this particular study is that we took a group of people with gout, we measured them when they came into our clinic, and then we measured them 8 weeks later. And we found that when we gave the people with gout good footwear, we found that it did reduce foot pain and impairment. And the question is, what do we mean by good footwear? And I've got the topic here, the good, the bad, and the ugly. And the reason I've used that is that we as clinicians talk about what is good footwear, and we can talk about what happens or what is inside a good shoe compared to a poor or inadequate footwear. And it's all to do with the materials inside the shoe. These materials are very robust, where these materials are very, very poor, made of cardboard, which break down very, very easily. The problem is we've got a shoe which looks pretty ugly to a lot of people, and you may not want to wear a shoe like that. So we've had many comments, although they say it's comfortable, it reduces their problems, they may not want to wear it all the time. So that's one of the address. So what goes into a good shoe for people with gout is that what we found in this particular shoe is that we have a zip in it, so it allows for any problems around the big toe to accommodate that particular problem. We have something called dual density midsole, and that's made of a material of quite a rigid but pliable material which controls the foot, and control and stability are very, very important in not only gout but osteoarthritis as well as rheumatoid arthritis. We have cushioning for good heel strike, so when the heel hits the ground it's adequately cushioned. We also have something called a flexion point, and what it is that it's a bend in the footwear which allows the toe to leave the ground quite effectively. I'm not going to go into too much technical detail, but these are quite important characteristics. And probably one of the most important characteristics is related to what we call a rocker system, which allows the foot or the person to walk quite efficiently across different surfaces. And different footwear have different rocker systems inside. So enough about footwear, and I'm sure I'm probably going to get some questions about footwear, but as people do ask, what about barefoot walking? Is it good or bad for you? I think barefoot walking is natural, but the feet are not designed to walk on hard level surfaces. And unfortunately, as we do get older, your foot does become less stable, and it does become more painful, particularly if you've got severe arthritis. And if you are prone to slips and falls, and we've done some work on falls and people with rheumatoid arthritis and foot problems, is that suitable footwear is better than going barefoot. And if, of course, you've got painful feet, then footwear should be worn. What about using creams and gels? You know, we do recommend certain foot creams which are useful. However, we are a little bit hesitant about creams that include acid, which use very, very strong acids, because that could be causing more problems than you can see if you just use a cream that doesn't include any acid. So your podiatrist will advise you on lotions and creams and ointments, and it all depends upon your condition of the skin, your current medical condition, accessibility to the foot. So if you've got arthritis in your hands and you can't get down to the foot, so we have to take that into account. And of course, any allergies to any news. Exercises for foot pain, I think, is highly recommended. We want you to keep mobile. It is so important to keep mobile, regardless if you've got arthritis or other medical conditions. It's always recommended that you do exercises, group exercises, particularly for rheumatoid arthritis, to show really good benefits. But individual exercises are good as well. And any form of exercise, which includes foot massage, is good and keeps you mobile, is a really important message. And it's all about alignment and joint mobility and muscle activities. But we've got to be careful that exercises should be undertaken which puts you at risk. So be aware of some of those particular issues, and we can give you advice on which is the best exercise to take. And here's just an illustration of some of the exercises specifically for the foot pain. You know, it's keeping that foot mobile. You could use a tennis ball. You can get someone to help you mobilize your feet, but you can move your feet by standing on tiptoe or trying to move your toes or to wiggle your foot around. As long as it's something to do with you're putting your foot to the ground and trying to enhance muscle activity and getting those joints moving again. I think it's quite important. If you can't do any of these exercises, just keeping mobile is so important. Now, we do recommend that you see a podiatrist, if particularly you have got foot problems, and access to private practitioners who via local websites or word of mouth is important. We do have a professional body called Podiatry New Zealand, and again, they can assist you in seeking out local podiatrists for your help. So they're state registered podiatrists here in New Zealand, and that's a good way of looking at where to go next. With access to orthotic services through ACC for foot orthosis has just recently come out, and so again, there are different funding mechanisms to look at. But also here in Auckland, we do run a university-based rheumatology clinic. Other rheumatology clinics around, there are ones I know in Wellington and in Hawke's Bay, but I'm sure there must be other services within the health service which are around for people to access. So in conclusion, we do see a lot of people with foot problems, and particularly with inflammatory arthritis, and I do include those people with osteoarthritis. As people with arthritis do experience considerable foot pain, disability and impairments, and that people with arthritis do experience difficulties in finding footwear for their pain and level of disability. But through a podiatrist, through advising people on good footwear and exercise as a part of a foot care package and reinforcing foot health education, I think we can do a lot for people to improve their foot-related problems. So I'd just like to acknowledge my clinical colleagues and my academics, particularly from Auckland University and from all the district health boards around Auckland for their assistance, and also my colleagues from here at AUT, but very, very importantly, I'd just like to thank Arthritis New Zealand in particular for supporting this particular presentation and all the work and all the research we've done through Arthritis New Zealand. So, thank you. So, I think the next thing is to look at the question and answering session. First question I've got is regard to exercise. What is your view on the most widely advertised vibrational devices? Yes, I've seen many of those advertised on the television. Oh, right. it's difficult to know whether they're successful or not. It's a very difficult thing to put across, because the evidence is not there, and therefore it's difficult to say whether it's beneficial or not. I'm inclined to say, or to think, that if you walk and you do physical activity, I think it could be beneficial to you as a person to do those kind of exercises. Whether you need to enhance that through other ways, I really don't know. The evidence is not there really to support what is going on. Another question: why are group exercises specifically good for people with rheumatoid arthritis? How is it different to independent exercise? I think it's all to do with motivation. I think that when you work, and it doesn't matter if it's for people with rheumatoid arthritis or any condition, working in a group motivates people to do things. It's also talking to people and experiencing what they're suffering from. And working in a social environment is very, very important. And I think that's why group exercise is probably motivated. You know, a set time it is for a group, and it's working in a group of people who are similar to yourself. Another question: what do you recommend to avoid osteoarthritis affecting the midfoot following ankle arthritis as a result of arthritis? Type of footwear, exercises, or therapy? Osteoarthritis is a very, very common problem, and we are finding through some of the newer evidence, because there hasn't been much research done on foot osteoarthritis, and what we are seeing, that the recommendations of the type of footwear, for example, is that it's got to accommodate your problem, particularly if you're suffering from midfoot. So you're going to have to look at footwear which holds your foot in place, and to make sure it's comfortable for you so you can do your everyday activity. In terms of exercise, it's just keeping mobile. In terms of therapy, heat therapy is supposed to be quite good to assist. I think it goes always back to mobility, and if you are in a lot of pain, then please see your GP or your rheumatologist. I think it's very, very important to look at that kind of issue, particularly if you're suffering with quite severe osteoarthritis around the ankle. I think it's important to consider that it's this multidisciplinary approach, and don't think you're on your own in this particular problem. Another question has just come in. The problem with group exercise is if you work, most are during the work hours. Is there any research regarding supporting the work population with group exercise throughout the country? That's a very good question. I think that what research has been undertaken has been related to groups, probably people who have retired or are in large communities where work has been undertaken in that particular population. Has it been undertaken in the working population? I believe there has been studies that have looked at group exercise in work environments. Whether it's been specific for people with inflammatory arthritis, I really don't know. But I know certain large institutes do support people doing group exercise. So whether that's related specifically to inflammatory arthritis, I don't know. But it's a very good question, which I probably don't know the answer to. Another question: are there certain brands of footwear available in New Zealand that are more supportive for people with painful feet or rheumatoid arthritis? This is the biggest problem, is that we encounter that getting good footwear that is New Zealand made is quite limited. I know Zahira, or Comps as they used possibly do look at accommodating and makes people's feet comfortable, particularly for women. And although they're not down the line of dealing with people with medical conditions, their footwear is quite good because they do look at comfort as an important aspect. And sometimes you have to look overseas to look at some of the commercially available footwear for people with rheumatoid arthritis. And there are some global brands which you could look at, which really do help people with rheumatoid arthritis. If I was asking this, if the question was being asked in the UK or the USA, I would give a different response, because there are companies over there which look specifically at people with severe arthritis. So here in New Zealand, and probably less so in Australia, it's looking at availability, and you have to look outside New Zealand, i.e. looking at retail brands which import into New Zealand, which obviously brings the cost up, and therefore it does make it another factor to consider. In some of our studies, and just talking about costs, we have found is that cost is not an important factor in people with rheumatoid arthritis, but what we have found is that cost in people with gout is quite a major factor, and it's something that we are looking at, is that can we look at a footwear which doesn't necessarily cost hundreds of dollars, but something which costs $30 or $40, which has the same characteristics of these good but high expensive footwear. A question is, what are some of the overseas footwear brands that you mentioned? I don't want to end up promoting a particular company, because I think it would be unfair, and I'm sure in the public domain, if I mentioned one particular company over another company, I think I would get some criticism. I think if you go into any good retailer, footwear retailer, they will recommend to you the most appropriate shoes for you, and without naming a particular brand. Another question is, can you recommend anything for burning feet? Well, burning feet it's something which could be related to circulation, or it could be related to the nerve supply to the feet. And it all depends on your medical condition. And sometimes we do see a lot of patients that have a particular inflammatory arthritic condition called lupus or scleroderma, who they have very, very cold feet, and then they come into a warm environment and suddenly their feet start to burn. And that is because of the circulation. You have very, very small blood vessels which go into the toes and they suddenly open up, you get that burning sensation. So it does depend on the medical condition of the person. Another question, does the Arthritis Foundation have some way of members providing recommendations on shoes they have found? Also, because rheumatoid arthritis is not supported through ACC, it is quite expensive to put a rocker heel or get an orthotic for shoes. My shoes cost around $250 to $350 each time. It is a big issue. It's a major issue. It's one thing I've experienced since being here in New Zealand, is the Orthotics Centre producing modified footwear for people with inflammatory arthritis. I don't know the way forward ACC are going to look at this particular problem, but I know there are early discussions with the Orthotics Centre, because they produce these modifications of trying to reduce some of this cost and trying to look at it in a multidisciplinary approach. Another question is, I have psoriatic arthritis and very bad pain in my feet, in particularly my forefoot and my hammer toes. I can't wear any sort of normal shoe or sandal because of the high price shoes. In terms of sandals, they rub. The last pair of shoes I did manage to find 3 years ago cost me $400, specifically for hammer toes. Do you have any tips for shoes or feet? Right, yes. People with psoriatic arthritis do suffer with a lot of toe problems and probably toenail problems as well. And the way to try and get around that problem is trying to find footwear which has got what we describe as a large toe box, which can accommodate those toes. But the only problem we have, not the only problem, one of the biggest problems we have is these shoes start to look quite, I hate to use the word ugly, is that they look very much like an orthopedic shoes. And when people are prescribed these orthopedic shoes, studies have indicated they end up in the cupboard hidden away somewhere. And so people don't wear them because of their appearance. And so how do you get around that particular problem? It's just trying to think what do you want, or are you really, or is the most important factor that in terms of appearance that you have to encounter? So it's a very difficult question to answer simply because of the problems you've got and how do you address those problems. And there are ways of dealing with it, but unfortunately those kind of footwear look quite ugly. So it's a catch-22 situation.
Thanks, Keith. It doesn't look like you've got any more questions at the moment. So I thought if you're okay, I've got some questions from some clients that I've had questions asked of me. So yes. Are you happy to answer those?
Yes.
Thanks. So one person has asked, I have bursitis in the back of my heel. What can I do about it?
Bursitis, depends if the bursitis is inflamed or not. If it's inflamed and it's causing a lot of problems, particularly when wearing footwear, then one can look at the footwear, but it may well also indicate that the person may be having a flare. And if they're having a flare, it may be that you have to take into account that the medications the person is taking may be that they may have to be altered, or I would suggest going to the rheumatologist or the GP, particularly if the problems persist, because that flare should reduce over a short period of time. But if it keeps on continuing to flare or become inflamed, then of course go back to the rheumatologist. But sometimes bursitis are there because it's been there for such a long period of time that it becomes calcified, so it becomes quite rigid, and therefore the biggest problem is that certain footwear is going to rub against it and cause an irritation. And what is needed is modifying of the footwear and perhaps some stretching of the shoe, which will allow that bursa not to be irritated on the heel.
Thanks, Keith. Another question. Let me know if you've got some that come in.
Yes, of course, yes.
So the next question is, what is the best way to reduce swelling in my feet across the top and around my ankles and the soles of my feet, which are red and painful?
Swelling is indicated of some medical condition which is affecting your feet, and people with high blood pressure, long-term high blood pressure, may encounter swellings of their feet, particularly at the end of the day, because what we encounter is that people will come into our clinic and the foot or the feet are quite swollen because of what we describe as edema, and that is because of the medical condition, as I say, for example, high blood pressure. but it also could be due to the arthritis itself and having some kind of reaction or action to that particular problem. So to answer that question, if the swelling doesn't reduce by the end of the day and it's continuing, and that is a problem which is happening over a period of time, then my suggestion is to go and speak to your GP.
Thanks, Keith. Another question is, a person is wearing gumboots most of the day for work. Yes. And is getting a lot of foot pain. Have you got any suggestions how that can be managed?
Oh yes, that is probably a big issue, because it's a work-related footwear, and of course that kind of footwear doesn't allow the foot to breathe, and therefore you're going to get a lot of a hot, I hate to use the word, sweaty foot, and therefore if the person has got arthritis on top of that, particularly if they've got inflammation, as inflammatory arthritis, is then going to be more susceptible to getting these low-grade infections. So the likelihood of developing warts or verruca, whatever the word you want to call it, or athlete's feet, increases quite dramatically. So advice for the person, let's say they have to wear them, and let's say they can't wear any other kind of footwear, work kind of footwear, then certainly using talcum powder or even some kind of anti-bacterial talcum powder before they work is a good idea, but also an opportunity perhaps halfway through the day to let their feet breathe and to wash their feet and do the same process again. So there is an opportunity for the feet to breathe, and it may reduce some of those particular problems.
Thanks, Keith. Have you got any questions that have come through?
No.
Okay. So are you happy to answer a few more?
Yes, of course, yes.
So there's one that's come through that says, I like to wear slippers. Is wearing slippers supportive shoes?
Right. Very good question, that is. If you compare wearing slippers to wearing socks to wearing bare feet or being barefooted inside, then slippers is the best shoe to wear, because most people like wearing slippers because it's comfortable and easy to put on and off. And I think that wearing slippers is fine, but if you are susceptible to falls and you've got a history of falls, then it's best to look at your slippers to see if they need replacing. You may want to get a new pair of slippers, because evidence supports the idea, or research supports the idea, that very old slippers can cause people to slip and fall. So the recommendations is that yes, you can wear slippers, there's no problem in wearing them, but if you are prone to falling, then I would strongly recommend that you look at them and maybe look at purchasing new slippers. I have got a question. The question is, I have ankylosing spondylitis. I've had extensive surgery. I have a screw in the back of my foot. So I think the question is probably, and how much discomfort is normal? That's a good question. No one should be in pain, but with the complex biomechanics, the mechanics of how we walk and what we do, it's always going to be a potential problem that having pain due to surgery may change the mechanics of the way you walk, and particularly if it's affecting the foot, is that if you are in discomfort, then you should possibly go back and speak to the person who did it, or speak to your GP, because you shouldn't really be in discomfort, but it's dependent on the level of discomfort you're in. Because if it's going to affect your everyday life, your quality of life, where you can't sleep or you can't do everyday activities, then that is not normal. But it depends on the degree of how uncomfortable it is. So if you're in discomfort all the time and it's affecting your quality of life, then I would certainly recommend you go for surgery.
Thanks, Keith. I have another question. How good are gel supports which you can buy from pharmacies? We see them advertised on TV.
Yes.
What's your view?
In theory, they sound fantastic. You know, they solve everything. But unfortunately, it's not just a simple applying a gel or something under the foot, because you walk walking is a very complex way of going from A to B, and you do a lot of activities which involves joint movement, muscle activity, and ligaments that work correctly. And just by putting gel under a certain area, it may not alter the way you walk. And although it sounds in theory great, they don't always work. And my recommendation is that if you are seeking advice on putting something inside your shoes, then I really recommend that you see a healthcare professional, because they could give you their advice, their knowledge, their experience on what is the most appropriate advice for you, rather than spending hundreds of dollars with over-the-counter products which may not necessarily work. Marketing is a great ploy of promoting something, but it may not be good for you, because you may need something quite specific for your feet.
Thanks, Keith. My last question is from somebody who's got orthotics. Podiatrist can suggest.
We have a whole range or array of different orthotics which are available for people with arthritis. And it depends on the materials are being used. The reason why a material, you know, the feeling it's hard is because the material can play around with different densities, different thicknesses of materials for that particular person. Because at the end of the day, orthotics should be comfortable. They really should be comfortable, and you shouldn't have them to feel rigid orthotics. It sense to me that the materials they've used are too rigid, and that because of the thickness or the density of the materials being used, and that's the reason why that is the case. So your podiatrist or your healthcare professional will give you, or probably look at your foot and then make a decision on the best orthotic for you. But it should be comfortable for you to wear, and you should not be aware that that should be the case. And we've had a question come in that, do you need to find a podiatrist who specialises in RA, or do all podiatrists know about RA needs? We train podiatrists here in New Zealand who we do emphasise high-risk feet. So we do emphasise people with rheumatoid arthritis. But there are some very, very good experienced podiatrists who perhaps haven't got experience in rheumatoid arthritis, but they may have experience in dealing with people, let's say, with diabetes. And their experience will help you in understanding your condition, and particularly if you're going to look at footwear and particularly foot orthosis. So it goes back to, how do you know or where to find the best podiatrist? That's a very, very difficult question. And I think speaking to people who go to a podiatrist, and particularly those people who have inflammatory arthritis in particular, they will advise you who are the best people around to treat the particular problems.
Okay, I think that's the end of the questions. No more, Keith?
Okay, no, there's no more questions, yes.
So thank you so much, Keith, for answering all the questions and all the great information that you've provided us in this webinar. We'll be sending out a survey to everyone who's registered for this webinar, and it would be great if you could answer it so we can just see how useful this session was to you.
Okay.
We'll be sending an email to you with this link, and would really appreciate your feedback. So thank you all for joining us, not only from Keith, but from the team at Arthritis New Zealand.
Thank you.
Thanks.